your Houston chiropractor, Dr. Gregory Johnson. We got Will back in here with us for day 2 of his treatment here this week at Advanced Chiropractic Relief. And he come in complaining of low back pain that was radiating down into his right leg, down into his right lateral lower leg, and into his big toe. Tell him about your first day of getting 2 adjustments, and then, because you were pretty scared when you first came in.
I was scared to do it. I really was. After doing it though, I was relieved. Yeah, that's the best way of saying it. Best way of saying it's relieved.
Now you know I'm not going to pull your head off.
Exactly. Exactly.
So, and we did go over all the consent things that you had concerns about.
Correct.
Both written and oral.
Yes, sir.
With you. So, you know, we always want our patients to know the risks that are associated with any chiropractic adjustment, not just the ring dinger and the BioPhysics adjustment, but any chiropractic adjustment.
Yes, sir.
And we make sure that is safe and going to be effective for the patient who's receiving the care. And you feel that way better today, right?
Correct.
Yeah. Okay, good.
Correct. Yes,
well, let's show them your posture first thing.
All right.
Let's have you go forward and backwards with your head for me, please. And then back to neutral. So, do you see the pattern that you've developed over time?
Mm-hmm.
Forward and right. That's from you sleeping on your side mostly.
Yes, sir.
Pelvis is still shifted right just a little bit. See, you have less room here than you do over here.
Yes, sir.
Okay, this being your 3rd adjustment for the week, we're going to do the ring dinger first.
Alrighty.
So when we get done here today, I would like for you to say a personal message to the friends of yours who sent you all those horrible videos about how dangerous this was. You can tell them what the real deal is. It's amazing what people talk about and they've never even had any experience with it. Like they're the expert in it. There we go. There we go. Yes, sir. And lo and behold, he's still kicking. People always used to think I was testing those reflexes to make sure the patient wasn't paralyzed, but it's really to analyze if there's been any improvement in your patellar reflex.
Yes, sir.
And there has been, by the way.
I believe so.
So show them how you get up on the side that I taught you. There you go. Good job. Okay, let's come over here on you. Tell me next. Legs are even today. That's a good start. And they stay even. Does that cause back pain?
Smooth.
Good. Every time. We're still going to adjust your pelvis, your sacrum, and your SI joints, and your lumbar spine, because these adjustments are cumulative in nature. So this 3rd one's building on the first 2 that you had, and the one this afternoon will be building on this one and the first 2 you had. Okay, slide down this way about 2 inches. There you go. Oop, wrong end. Yeah. Good. Okay, let's turn you on your back. Slide down about an inch. A little bit more, maybe. There we go. Yes, sir. I still get you sweat, though. Okay, let's put both arms out like this. That just means we're activating your autonomic nervous system, which is a good thing. Just slide down about another inch for me, please. There you go. Maybe about another inch. There we go. Adjusting your clavicles, your AC joints in your shoulders, your anterior rib cage. Okay, you can relax your hands there now. Let this one go like a limp rag. There we go.
Oh, that felt good.
Yes, sir. That's the ring air from the lower end. Yes, sir.
Oh yeah.
Cool.
That felt really good.
Alright, let's sit you up sideways, face first, shower. Remember to keep that chin up. So since this is a private video for him, when you see him walking around the house like this, you slap him upside the head and tell him it's for me. Straighten up. You know when I give your wife permission to do that. They usually take that advice.
I can see that.
Yep. Good, okay, now let's go over here and shoot you again. Alright, we're starting to get your neck centered up a little. Still need some work. That opened up your pelvis though. See where your hands are back on your pelvis now?
Yes, sir.
Out in front of you yesterday?
Yes, sir.
Okay, show me your homework. Okay, remember 3 stages. Here, watch me in the mirror. Shoulders up and back first. Retract that head backwards, then look back. There you go. So you can watch this video now and know exactly the right exercise.
Exactly.
Go ahead and bend your head forward and backwards again. See if that feels any different.
Oh yeah.
That's smoother.
Smoother.
So what would you tell people about the one specifically who was trying to talk you out of coming because this was so dangerous?
It's scary and intimidating, and that first ring dinger is intense.
Yeah.
It's a lot of
A lot of
euphoria,
things moving
release,
that
and
you haven't
moving.
ever
Yeah,
moved.
exactly. But I mean, it opens you up. I know I could breathe better
Yes.
whenever I left. Literally,
That's
I
a
could
common.
breathe
That's
better.
a common.
It's like everything was just pushed down.
Thing that we hear from all of our patients. They breathe better.
I definitely could breathe better.
Well, that's because we're adjusting your rib cage front and back and your thoracic spine, so we're allowing your rib cage to open up at its maximum capacity for lung inspiration.
Yes, sir.
So, what made you feel comfortable to let me do this yesterday when we were doing the history and exam?
To be honest, knowing that you're a Christian,
Yes.
it made me feel a lot more comfortable.
Okay, good.
It did.
And we do put God first and foremost in
Correct.
this practice. And,
Correct. And like
He's the one healing anyway.
Like you said, there was something that was against me, and it wasn't God.
Right, right.
So
Yeah.
it made sense.
Yeah, that fear is not of God.
Correct. Yes, sir.
And that's what a lot of people have, is that they think I'm going to rip somebody's head off. But, 43 and a half years now, and I'm not injured one person, even alleged being injured,
Yes,
let
sir.
alone have a malpractice suit.
Yes, sir.
So, do other people in your family have a spine?
Yes, sir.
Okay.
Yes, sir.
If they got a spine, they're walking around in gravity, they should get this done. It's that simple.
It works.
It does work.
It does work.
Well, thanks for sharing your experience with everybody.
Yes,
You'll
sir.
have this private video by this afternoon or in the morning.
Okay. Thank you so
You're
much.
welcome so much. It's your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. And we've got Will in here from Southern Alabama. We'll see y'all soon.